process of the implant settling. Sometimes you'll hear the term dropping and fluffing. So what's actually happening, oftentimes we are putting implants under the muscle, and when we do this, the space can be quite tight. Initially, after surgery, patients will often feel like their implants are sitting very high, almost under their chin. Things haven't stretched out, made room for the implant. That's not just the muscle, but also the skin. So even when we go on top of the muscle, it can feel like that. That constant stretch that the implant is putting on the surrounding tissue, the skin, muscle, everything starts to relax and stretch out. And as that happens, the implant starts to settle into its final position. It can take several weeks, it can take several months. Some of it depends on each patient's own characteristics of their skin and tissue. An 18-year-old will settle at a different process than a 35-year-old, and it also depends on the size of the implant, where the implant was placed. One of the things we talk about after surgery when instructing patients on doing implant massage, something that may or may not help, but if patients do like the process and feel like they're in some control of allowing the implants to settle, so I think it can be helpful. I don't really usually recommend those bands that you'll sometimes see that patients wear unless they're really having difficulty getting their implants to settle. Eventually the implants do get to their position. Some women will come in at their 6-week post-operative period and the implants already look like they've been there for years, and others it will take them 6 months. The process varies from person to person, but eventually it gets to where it needs to be.